Hello everybody, welcome to number 1 Doctor channel. Today we will talk about fissure and anal fissure. A fissure is a tear at the anal margin, which usually follows the passage of a constipated stool. The site is usually posterior in the midline, 90% of men, 70% of women, occasionally anteriorly in the midline and rarely multiple. The posterior position of the majority of fissures has traditionally been explained by the anatomical arrangement of the external anal sphincter. Its superficial fibers pass forward to the anal canal from the coccyx, leaving a relatively unsupported V posteriorly. However, mucosal tears are probably quite common, and while most heal spontaneously, those occurring posteriorly or anteriorly are slow to heal because of the relatively poor blood supply to the anal mucosa posteriorly. The interior fissures of women may be associated with weakening of the perineal floor following tears at childbirth. Multiple fissures may complicate Crohn's disease, one of the colon. Clinical features. Acute anal pain is characteristic. It is stinging in nature and lasts for a while after the passage of stool, sometimes 2 or more hours later. Fissure is the most common cause of pain at the anal verge. There is often slight bleeding and, because of the pain, the patient is usually constipated. On examination, the anal sphincter is in spasm, and there may be a sentinel pile protruding from the anus, which represents the torn tag of anal epithelium. The fissure can usually be seen by gently pulling open the anal verge. It may be impossible to do a rectal examination without anesthetic. The fissure may then be palpable as a crack in the anal canal. Treatment. Early small fissures may heal spontaneously. A local anesthetic ointment together with a lubricant laxative may give relief. Application of 0.4% glycerol trinitrate (GTN) or diltiazem cream relaxes the anal sphincter, allowing the torn epithelium to heal. Injection of botulinum toxin into the anal sphincter to create a chemical sphincterotomy appears to be as effective as GTN ointment in facilitating fissure healing, but with a small incidence of incontinence of flatus and liquid feces afterwards. The effects are more sustained than topical creams, and last around 8 weeks. Intractable cases usually respond to dividing the internal sphincter submucosally under general anesthetic. It is important to take a detailed history of continence and to assess the anal tone prior to performing a sphincterotomy, as incontinence may result, particularly in patients who have suffered previous obstetric injury. Anal stretch, once a common treatment of fissures, has been abandoned because of the damage it caused to the sphincter with associated incontinence. A chronic recurring fissure in ano requires excision. Thanks for watching. Please like and share our videos and subscribe to our YouTube channel number 1 Doctor. With my best wishes. Dr. 8 Famid.